This video demonstrates manual motor testing, including the MRC scale for muscle strength. First, 5 tips for manual motor testing. Number 1, determine the patient's normal range of motion. Number 2, stabilize the patient's limb so that the motion that you're testing is ensured to be from the joint you desire and not the joint above or below. 3, apply resistance at the mid of range so that it's fair for you and the patient. 4, start slow, gradually building up your resistance while the patient isometrically contracts their muscle. And 5, always remember to compare to the opposite side. Next, let's refer to the 5-point scale. On one end of the spectrum, 5 is normal strength, 0 no contraction, 1 a flicker or trace contraction. To get a 2, you need full range of active movement with gravity eliminated, 3 active movement against gravity, and 4 has movement against gravity and resistance but is not quite normal. The best way to manage this is actually to start in the middle of the scale. Observe the patient's range of motion against gravity at any particular motion, in this case, elbow flexion. If they have full range against gravity, they have at least a 3. We'll now apply resistance. Stabilize the patient's joint and apply a steady resistance at about the mid-range to determine whether or not the patient has a 4 or 5. If strength is normal against your resistance, it scores a 5. However, if strength is reduced to your resistance, especially compared to the opposite side, it would score a 4. Now going back to active motion against gravity, according to the MRC scale, any movement would give you a score of 3 out of 5. However, some scales and clinicians actually require the patient to have full range of motion against gravity to get a 3. If the patient doesn't meet criteria for 3 out of 5, you'll determine if they have a 1 or a 2. From here, you're going to place the limb with gravity eliminated. The limb is parallel with the floor. If the patient does have full range of motion and elbow flexion with the gravity eliminated, they would score a 2. However, if in this position the patient does not have full range, they would score only a 1. If there is a flicker, this would also score a 1. If no motion at all is seen and no muscle flicker over the elbow flexors, this patient would be scored a 0. The same procedures can be replicated for any joint and movement that you would like to test.